Hi everyone. So my name is Phil and I'm here on behalf of Elsevier to share with you some of my tips and tricks in getting the best possible marks in your medical school exam. So let me introduce myself for those of you that don't know me before. I graduated with a triple first class degree from Cambridge University in medicine and trained in my foundation/intern years in London and then working in medicine before retraining in family medicine and also working now as an educational supervisor for Leeds Medical School in the UK. I'm the current editorial head for Elsevier's Clinical Key Student Assessment Platform, which is a unique platform that uses the power of technology to bring a smarter way to conduct medical student assessments. And I'm also the series editor and assessment editor for the Crash Course series of 14 medical textbooks, which you may have seen as well. And all these textbooks are up for you to grab if you just submit your nomination in at the end, where Debs will send out a website link for you to put yourself for a prize draw. Now, last month I was invited to give a talk in the European Board of Medical Assessors on the future of medical school testing. So as all of you know, I try and keep up with the latest medical assessment and educational developments around the world so that can really give my students that edge. I really love to try and find ways that can make studying effective as possible so you can get the most marks in the least possible time spent. And this is one of the last webinars that we'll be doing in terms of distilling to you some of my knowledge and experience. I'm going to give all the viewers here today, right now, my top insider tips gleaned from years of experience, from the research on how not to just survive in medical school, but succeed and get the top grades and reach your fullest potential as well. Okay? So we'll take a first look at techniques to tackle test anxiety, allowing you to find your flow. Now, finding your flow is something that I mentioned in the last webinar. And here we'll talk about the 3 Ps, the planning, the practice, and the perspective. Then we'll go through a list of things: how to deal with time constraints, how do you avoid making stupid mistakes, how should you change your answer that you've given already in an MCQ test, strategies for dealing with MCQ tests, strategies for doing essay questions, strategies for doing open book exams, and planning your test day itself. So let's get kick-started. Now, when you've got a big test coming up, it's absolutely natural. It's natural to feel a little bit stressed. In fact, a little stress is actually good for you. It gets your blood pumping, it makes you more alert, but too much stress can make you feel paralyzed and negatively impact your performance and results. And there's a few ways you can tackle your anxiety and make it easy for you. And they all start with P. And as everything in medicine, pretty much all comes in threes: preparation and planning, practice, and perspective. Let's go through each of them in turn. Now, the one thing that you can do to reduce stress is to be prepared. The more prepared you feel for something, the less stressed you feel. Plan your schedule, spread your revision over as much time as possible. Now, and you can look at that first webinar on study skills and how best to do that. Research will show that you retain information better when you accumulate it gradually rather than try and cram it and overloading your brain all at the same time. Closer to the test, you might want to make a more intense study schedule, spread over as much as you can over any possible available days and times. Now, but how do you actually overcome test and exam anxiety itself? And some exam anxiety are good, okay? It means that the exam means something to you. If it didn't, then you would not feel any emotional response to it. Your body releases stress hormone, adrenaline, noradrenaline, and cortisol. And a little bit of these hormones can improve your performance. And the nervous excitement is good. But if you let it overwhelm you, then it's bad, okay? Too much stress can overwhelm, make you freeze up, and negatively affect your results. And the answer to all of this is just doing practice, practice, practice. Stress is always higher when we're in unfamiliar territory. So the action, your aim, is to get yourself familiar with exam conditions. You should really be mimicking the exam conditions as closely as possible. If you're doing it online, then you need to get the keyboard that you're going to be using on the day. If you're going to be wearing a set of clothes, then wear that set of clothes for practice as well as for the real exam itself. If you're going to be using a pencil to mark down on a piece of sheet, a piece of paper, what you're doing, then yes, you should be using the exact same pencil if you can. The closer the conditions of your simulation to the conditions of the test, the more familiar and more comfortable you'll feel in real test conditions. If you're writing your exams remotely, this will be easier than usual, as you'll be in a familiar space. Now, when I took my exams, coming up to all my exams, I made sure I worked out a route to the exam hall. I worked out where it was going to be. I planned my route there, planned my route back, and what I was going to wear, what I was going to eat, what I was going to drink, days and weeks before the exam itself. I would do dry runs going to the exam hall and coming back again. So that way I would have one less thing to think about on the exam day itself. And that's exactly the same. If you were doing driving lessons, if you were driving on the same roads, you want to do the actual test on, because it makes life easier, less stressful if you've been in the same situation and same positions before. Now, if you have exams at home via online proctored exams, then this is even more reason to organize your study space to make it an optimal spot to take your exams. Now, of course, there are other things to be concerned about, like your Wi-Fi, that you should explore all those what-ifs that you're worrying about. Find out what you should do in the event of a connection problem, as this will make you feel more prepared and empowered to dealing with any possible unknowns. Now, another big benefit from planning your study schedule in advance is that it gives you plenty of time to include breaks in your test revision schedule. Exams are as tough on your body, if not more, as they are on your brain, and they demand really hours of concentration and hours of effort. So it's important to build up stamina, both physical and mental. Eat well, get exercise, and get enough sleep and fresh air to allow your body and brain to perform at their very best. Practice will also help you build the stamina you need to get through the exam. Now, think about an athlete. You won't expect an athlete to run for 2 hours without a practice, and the same goes for your body during an exam. Athletes also think about the nutrients they give their bodies to help them win, and you should do too. Now, the third P, okay, which is perspective. Let's talk about the stakes. Yes, it's a high-stake exam, especially when it's an important test, but you need perspective. After all, it's just remember, just one test, and one test does not define you as a person and doesn't define you, your successes or your failures. One way of getting perspective is to use a notebook to write all your concerns, write all your fears down, and then you reduce them to a list. And then you reduce them in your mind as well, and you offload it from your mind onto the list. And the simple action of writing down your fears transfers them out of your mind. You don't have to worry about them over and over again. Now, one of the things that some people do when they got a lot to do is jump from one thing to another. And that's something you want to avoid, especially when you're working through practice questions. You've got a lot to cover, so you naturally end up jumping through papers without really giving yourself time to reflect properly. And this really results in what we know as passive learning. And there's so much better ways to learn. And you can think of it as quantity versus quality. Going through past questions, going through practice questions is great, but don't just continue to do question after questions and seeing how many you got wrong and then moving on to the next one. You're not learning anything. You're not learning anything by osmosis when you're doing that. Remember, before we talked about in the last webinar about a growth mindset, learning from mistakes and how often we learn more from mistakes. Well, now is the perfect time to put the idea into action. But you can't learn from mistakes without actively figuring out where you went wrong and what you need to do next time. Now, you might just read the solution for the questions you've got wrong, which is better than just moving on, but it's still passive learning. Is not as active as if you try the question again before coming up with the answer. If you get it wrong, try it again and only read the solution when you get it right. When you do this concept, really, it gets reiterated in your mind and you learn properly. You won't make the same mistake again. So plan to spend as much, if not, to be honest, more time looking back over the questions to see how you can improve. If I were to do a 2-hour mock exam for a finals paper, I will probably spend about 3 or 4 hours dissecting all my mistakes and learning all my areas of knowledge where there are gaps. Look through the solutions, okay? And that could be whether the question got right or got it wrong, and practice deliberately. Now, forget about the old way that says practice makes perfect. Now, deliberate practice makes better and better. Get as much as you can from this process, okay? So You can obviously practice questions using different ways. One way that you can do is go through the 1000 question SBA book for medical finals for you as a student. And this has got quite detailed questions and answers that you can buy from Amazon or the Elsevier website. Or if you sign up by Deb's URL link, then you can actually get a chance to win it all. Let me show you what I mean by deliberate practice, okay? So this notebook I dug out from a long time ago. This is from about maybe 10, close to 15 years ago, actually, probably even longer. All the questions I've gotten wrong from any practice question bank, from any book, I jot down, and I make sheets and reams of notes in terms of what I think should be done with clinical vignettes, and make specific notes. And I think that's crucial, because only through this, and only through jotting down my areas of weakness and everything else, that can really show and really highlight what is happening and where I need to learn from. And that was really one of the main cruxes of my speech for the European Board of Medical Assessors Conference, using assessment as a learning tool rather than assessment of any learning that you've had in the past. Okay, hopefully the exercises above will leave you feeling less anxious for when it comes time for the test and help you perform at your best. But let me talk about some test techniques that you can use to improve your performance during the test itself. You may have heard of something called metacognition. And metacognition is really thinking about a useful strategy when it comes to learning. We can use our understanding of how we think to guide us on our actions that will result in a better outcome. Now, imagine that you know in a specific area, perhaps rereading multiple choice questions, you often make certain mistakes. Knowing this can help you ensure you pay extra attention to this area to avoid making these sort of similar mistakes. Now, let's see how this technique can help us dealing with the pressures of time. Perhaps you're someone that never manages to finish a test because you've got a lack of time. Knowing this, you can make strategic decisions to make the most of the time that you have. Okay, now, funnily enough, the first rule on making the best use of your time during an exam is not to hit the ground running. Quite the opposite, in fact. Okay, spend a couple of minutes looking through the test. Allocate time to each question based on how much each question is worth. There's no point spending a whole lot of time on a question that isn't worth that many marks. You want your effort to count for the best results. So, for example, say the total test duration is 2 hours and there are 4 questions. If a question is worth 10% of the total mark, it's worth 12 minutes. Whereas if a question is worth, say, 40% of the total paper, then you want to allocate 48 minutes to complete the question. You don't want to spend a lot of time on a question that isn't worth that many marks. Stick to the schedule. Keep an eye on the time, especially if it's an essay question. You can plan to wrap up your conclusion as you approach the allocated time. If you do all of this, you'll ensure 2 things. Firstly, you won't be rushing through questions because you know the time you have to spend on each of them there. And secondly, you won't come to the test and realize that the last question you didn't get to is the question you knew most about and can easily write a lot on. So plan to allow time at the end for a review, because research says reviews can have a positive effect on your marks. If you come across a question and you don't know the answer, skip that question, but allow time to come back to it in the end. Before moving on, however, reread the question. The strategy behind this is that whilst you're working on other questions, your subconscious mind is working on that unanswered question. So you might be surprised to find that when you come back to it, the answer is relatively clearer to you. Now, when you finish a test, you're going to be exhausted and you probably just want it to be done. But research shows that reviewing your work will likely result in improved marks. So spend the spare time checking your answers. You put in a more enormous amount of time into studying. You need to stay the distance and finish it. Now, the one thing you really want to avoid is making silly mistakes. But this happens more often when you're under pressure. But there's a couple of things you can do to avoid making them. First, you need to know yourself. Know the types of mistakes that you tend to make and watch out especially for those types of mistakes. Now, do that for each particular section, each particular question. All the mistakes you've done, write it down. And do you remember when I went through to the first webinar where I had a blank sheet of paper and then I wrote on the blank sheet of paper all the learning points from, say, the topic of atrial fibrillation, and then used a red pen to go through anything I've missed and kept a chronological serial testing solution for all of that with spaced repetition? That is what you should be trying to do. Okay, so let's look at some common silly mistakes that everybody makes and some techniques that you can do. Now, it may seem quite an obvious thing to say, but you need to pay attention to the question. Lots of people make very simple mistakes by not even reading the question properly. And an old chemistry teacher used to say RTFQ, which is read the full question. So read and reread the question. Questions, especially in multiple choice tests, can trip you up. One tip is to use your finger just to trace the words of the question as you read. This will slow you down and ensure you don't miss one word that might change the entire meaning of the question itself. Then, in order to avoid making mistakes, when you transfer the answer, say the number or letter in your head. This is also a really silly mistake, but you'd be surprised at how easy it is to make. I always recommend you transfer across answers, even when you're not confident of the answer, because it makes it easy to look over an existing answer present when faced with masses of blank answers when you're time pressured. So always aim to transfer across the answer onto the answer sheet itself if you're doing something like an MCQ. Another good practice is if you're using scratch paper, so like a scrap piece of paper, make rings around the work and keep your rough calculations or notes on each question separate from each other. So don't blend them in, use the paper, annotate, say this is question 3 or whatever. Again, you don't make a mistake when transferring the answer and your worked out solutions from the scrap piece of paper to your test answer sheet. More importantly, it allows you to go back to the workings out and review your working out appropriately without having to do things from scratch again, which I think is going to be quite important. Okay, we've talked about reviewing your work. So what happens when you come across an answer that now looks wrong to you? Should you change your answer or not? I think this is very common, isn't it? You've got basically, you filled in the MCQ answer and you think, could this be C? Could this be A? You don't know. Do you scrap the answer? Do you try and change it, or do you stick with it? That's a common dilemma for a lot of medical students. And you probably heard things like go with your gut, don't second guess yourself, stick with your first answer. You may even have experienced a time when you actually changed an answer when you should have stuck with your original answer. Research shows that 75% of students believe that changing an answer on the test results in worse grades. And guess what? They're all wrong. Okay, we're biased towards remembering when we incorrectly changed our response because it causes more frustration. Research actually shows that people who change their answers on tests end up with a better grade than those who don't. Now, in my personal experience, and this may be different to you, for questions that I change the answers to, I get it right around 55% of the time. Had I left the answer alone with the original answer choice, I only gotten about 45% of those types of questions right. So you can see already there's a nice performance bump, but at the expense of taking a long time in the test. And this certainly is backed up by the research that we see. However, it's really, really hard to decide whether to change an answer or not. So what we do need is a scientific way to work out whether we need to change it. And this tip is also going to be based on metacognition. Studies have found that our confidence in the results of our answer can vary greatly. You may feel more confident in your exam results after a few days than you did immediately straight after the exam. And studies does show the closer we are to the event, the more reliable our estimation is. So straight after you answer a question, rate your confidence in your answer 1 to 5, with 5 being super confident and 1 being not confident at all. Just make a tiny note to the right of the question paper itself. That way, when you come to review the answers and you feel you might have a better answer, but you're not quite sure, you'll have your level of confidence at the time you wrote the answer to guide you. You can compare your level of confidence at the time you wrote the answer to the level of confidence you feel now when you come to review it. If you see at the end of answering the question you weren't confident and then changing to another answer makes more sense. If you see you were pretty confident at the time but aren't feeling that confident now, then you should just leave it as it is. So let's talk about multiple choice. You might have heard from friends, if you're in doubt, choose answer option C out of 5 because that's the middle option. Well, unfortunately, that's not quite true. So the tests are somewhat statistically random. So guessing a C will give the same chance as any other guesses that you make. And this may change from exam to exam. However, interesting enough, some research does show a bias of 56% towards true answers being correct in true-false multiple choice tests. And there is a likelihood that an answer in a multiple choice test will not be the same as the one before it. But we definitely wouldn't recommend you relying on these tricks like this to make you pass your medical school finals. However, there are some tips that can make a real difference to your success. We've talked before about taking a few minutes to look through the test before you start, and this is even more important for multiple choice questions. In fact, one particular strategy that I find some students use is that they want to complete them in 3 rounds. Okay, so in the first round, they skim through the questions and mark off all the really easy answers. Those that they find that the confidence is 4 or 5, they just mark it down straight away. The advantage of doing this is that you skim through all the questions, and you actually might find some clues to the answers of the other questions itself. And in the second round, they aim to answer all the questions, but skip the really hard ones. So maybe all the confidence intervals between three and maybe 2 or 3, maybe just 3 by itself. Remember to read the question and let your subconscious work on it. And the third round is, if you've got time, come back and try those hard questions, the ones that score 1 or 2 again, and review them to see what the results are. Now, we've mentioned reading your question more than once here, but here's another strategy that works really, really well when it comes to MCQs. Take a blank sheet of paper or your ruler and cover up the answers when you read the question. It can be helpful for a number of reasons. First, it allows you to focus on the answer. It allows you to focus on the question itself, and then allows you to think about the answer without being distracted or misled by all the other possible answer options. And lastly, if you see your answer in the options, this confirmation means that you can probably have confidence that you've got the right answer without needing to review and waste time considering all the other options here. Okay, and I think that's quite important for you to consider. Now, when it comes to essay questions, you should always plan an outline before you begin. And here is a technique for creating such an essay outline. First, you've got to read the question and jot down all the points on the scrap piece of paper that you can think of that will answer the question and support your answer. Then, create an order for the essay by putting numbers next to each of the main points you want to make. Perhaps you want to order the essay starting with the most important information, or perhaps the paragraphs correspond to the different aspect of the question, or maybe even a chronological essay works better for you. Then you need to plan an introduction and then plan a conclusion. And your introduction should really get straight to the point and be concise. It should be really able to demonstrate critical thinking. When you get to the conclusion, remember, this is your final chance to convince your lecturers of your knowledge of the subject. Aim to summarize all the points you've raised during the essay into a conclusion with your personal spin on it. And once you've planned the essay and fleshed out what you want to say, then you can confidently put pen to paper and write an impressive introduction, all the main points, and then the conclusion succinctly, without errors and crossed out and jumbled thinking. Now, I'll be honest, one of the most impressive essays I've ever marked as an examiner in Cambridge, when a student was writing about cell biology essays and about cellular matrix and cellular junctions, and he began his memorable essay with this following words: "No man is an island, and the same could be said of cells." This is in recognition of a famous 400-year-old poem. And this essay got excellent marks. It showed confidence. It grabbed my interest as a marker, and I'd be marking tens or hundreds of essays on the same topic. And it demonstrated showmanship, and it demonstrated mastery of the topic. And then from one subsequent reading of the essay, it allowed me to find confirmation bias as an examiner, to find evidence and examples to award the student marks, to confirm what I thought about him based on his introduction. And it's evidence in itself that even 15 years on, after marking the essay, I can still remember this introduction sentence to this particular essay. Now, let me talk about open book exams. One of the most important tips when it comes to open book exams is don't get complacent and study hard. Okay, you're not going to have time to look everything up. And the more you know and don't need to look up, the better it is. Or if you do need to know, be aware and practice on using the same resources that you'll have on hand so you can use speed and familiarity to your advantage. Then get yourself organized. Find out exactly what you'll be allowed to refer to in the exam, and then prepare the material so you can find the answers quickly. So by that I mean, if you're taking your entire textbook with you, use sticky notes or tabs to separate the chapters. You might even want to use a summary on each chapter on the notes that you make to make it easier to access the material that you're looking for. And when it comes to your notes, don't plan to take everything with you if there's an open book exam, because there's too much to manage. You need to create summary pages with the really, really important points, or even a page with formulas so it's high yield and you can use that as a reference text. or you can, if you want, do an index page to help you navigate to the right notes. But let me put it more clearer. If you put that amount of effort in documenting, indexing, and reviewing all your notes at this degree, often you'll find when you go to an open book exam, you've actually memorized the content in the first place, and you don't need it to be open book because you've actually physically memorized it. Now, how do you plan your test day? You need to pack your bags with everything you need for the test. Okay, that's very simple. Pencil, pens, notebook, scratch paper if you need it, or maybe even a calculator if you're allowed it. Make sure everything's done in terms of batteries. That way you have reduced your anxiety. Now, since you won't be able to bring your cell phone, make sure you got a watch to keep track of time if you can. Get some water, maybe a health bar to munch on before the test itself. If you were allowed some water, I normally have some warm water and then lukewarm, mix it with some dextrose or glucose tablets, dissolve it, so that way we'll have a little bit of glucose, which is warm, which will help somewhat with cognition, I'll be honest, and reduce the amount of blood flow going to the mesenteric arteries and the veins as well, to try and equilibrate the coldness. Get a good night's sleep before the test as well. Ensure you get to exam on time, okay? Plenty of time if you can. You don't want to arrive frazzled. You don't want to arrive out of breath from running. You don't want to arrive really, really anxious. And remember what I discussed last week, okay? What did I discuss last week? I discussed about flow. And you can use the 4-7-8 technique to really, really focus your mind. You need to expel negative thoughts. And let me remind you of what the 4-7-8 technique was, which was to expel all the air, breathe out everything, then inhale over 4 seconds. And then after 4 seconds, hold your breath for 7 seconds, okay? And I want to expel everything, and that will take 8 seconds in addition to all of that. So that's expel everything, inhale over 4 seconds, and then hold your breath for a total of 7 seconds, and then expel over a total of 8 seconds. That's the 4-7-8 breathing technique to really focus your mind. It works for me, it works for my students, and I'll be honest, it does work for a lot of my patients as well, with anxiety, with panic attacks. That's psychological. Okay, you want to expel all those negative thoughts when you're doing this. Focus on the positives and really focus on demonstrating and using the exam as an opportunity to showcase and highlight your knowledge, rather than cower in fear in the thought that the examiners will shine a light on your knowledge gaps. And this is the same that went for my Viva. When I went to my final year Viva at Cambridge, I wasn't afraid that the external or internal examiners will pick apart my thesis and my dissertation and say, oh, tell me about this, tell me about that. And I'm thinking, oh, I don't know this and I don't know that. I use this as a learning opportunity to try and say, right, I don't know this, but from first principles, this could be like this. But, what did you have in mind? And the examiner is impressed, because not only are you not saying you don't know and that's the end of the conversation, but you're able to come up with some first principles, and you have the inquisitive nature that is so important in being a medic. One last thing. Okay, plan a treat after the test, because you really do deserve it. Succeeding in exams is really not easy. Okay, I know, because I've sat in many of them. I've set even more exams. It's designed to be hard. It's designed to differentiate the best students and the less able. It's designed to stretch all ability classes, and that really is a marker of an excellent exam and an excellent examiner who sets those exams. And that's what's designed for you to do. If you've walked out the exam and said that this exam is too easy, then the exam has failed. So it's right that you're stretched. Now, hopefully, after hearing this webinar and looking at the previous webinars, you will stand in better stead in terms of your experience. I want to move now onto the Q&As, because I know that we've got some questions stocked up. So in the chat box under Q&A, if you have any questions that you want to bring up, then please don't hesitate to put in the Q&A, so that way Debbie can triage them and I'll be able to answer them for you. Okay, so let's go through some of the questions that's been submitted so far. So what techniques are classified as either active or passive learning? Good question. So I went through some of the basic techniques in my first webinar, but just summarize for you. If, for example, I was reading a textbook, and I was reading a textbook of, say, cardiology on atrial fibrillation, and I was just going through it, and I read it. Introduction, epidemiology, pathology, the pathophysiology behind it, the management, the investigations, etc. That is passive reading. I'm just ingesting it passively. However, active reading and active recall, is really something that you want to do. And that is you get a blank sheet of paper and you write atrial fibrillation on the top, and then you try and regurgitate all those topics down from pathophysiology, pathology, management, investigations, epidemiology, and write that down. And that is really active learning, because you want to shine, you want to demonstrate what you have actually learned rather than just read. And this is, again, this goes similar to questions. You can click next and choose an answer and press next and go on and skim read the answers, but that is just very passive learning. You don't absorb much, and neither would you absorb much if you just played an audiobook on the background and thought to yourself, right, I'm just going to listen to it without making active reflection. Active learning is when you actually reflect on where you went wrong and work out what the right answer is and try and work it out for yourself. And then once you understand the topic, try and regurgitate it. Even better still, if you can demonstrate that same topic to another student, then you know you've mastered the topic at heart. And that is the key. You can do 20 hours of passive learning, and 1 or 2 hours of active learning will far, far, far surpass that. Okay, so active learning is a much, much better method. It's harder, it's much more intense, and sometimes it's not nice when you're faced with a blank sheet of paper and you're trying to write things down and you realize that you've not learned half the stuff. It doesn't matter. If you just carry on ahead with that and try your best with active learning, then you will get into a mind frame, a mindset that you can achieve. Okay, so about multiple choice exams, what will be the best method to study for this type of exams? That's a very good question. In terms of multiple choice exams, it's different. Do you have the single best answer? You have the EMQs, and you have other types, click and drag. Depends on what exam you're dealing with, that's all multiple choice. But in essence, one of the best methods to study is to know the topic by heart initially when you are studying for the test. So if there was an MCQ for atrial fibrillation within, which is a subtopic of, say, arrhythmias, which is a subtopic of, say, cardiology, then you'd want to know the topic of atrial fibrillation and be able to write down off by heart on the topic with spider diagrams all the different key points here. If you can do that, then you can normally answer an MCQ. But that doesn't address test validity, because when you actually sit the test, you'll realize actually maybe the examiner isn't asking you to regurgitate the actual topic itself. What they're asking you to do is use your knowledge that you've learned and analyze it and reflect on it and actually answer a different question. Making a diagnosis may be simple, but managing and balancing other things within the clinical vignette and trying to come up with a conclusion of how to investigate when there are contraindications, for example, in the clinical vignette, makes it much more harder. And to do that effectively, really, you have to practice questions, because then once you've done enough questions and enough active learning of your weak points based on those questions, using assessment as learning rather than assessment of learning, then you'll be able to answer questions, especially MCQs, much, much easily. I can guarantee you, if someone sits down and do 10,000 MCQs, but without taking it in, they will do no better than someone who sits down and just do 500 or 600 questions of high yield MCQs and really focus on the weak points. Common things are common, and examiners will normally test common things for you. There will be an outlier. So there will be on the bell-shaped curve in the normal distribution where there will be questions that are a lot harder, and they will be able to design to stretch. And those sort of questions you may not be able to predict. You may not know the answer, but you might want to have the time, and you might be able to have the time rather to come up with some first principle questions on how you might be able to answer them. But you need to get the rest of the bell-shaped curve secure in the knowledge first. Okay. The next question, I was wondering what's the most efficient way to ace a one-way MCQ exam. I end up wasting a lot of time on the first question due to the fear I can't go back to them again, and the rest are left with a really tight period of time. It's just critical. That is a very good question. Okay, so a one-way MCQ system, for those of you that might not be familiar with the test, is the fact that it's just one way. Okay, so you have questions 1 to 10. You can do the question, you can move on with the question, but you can't go back to number 1. It is one way, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 in that sort of sequence. And because it is an unknown, and this really boils down to sort of game theory, okay? And the game theory is going to be very tricky. Do you spend a lot of time on the tricky questions and then know that you've run out of time the last bit? Or do you spend equivalent amount of time and then you realize quickly, actually, I've spent all my time in the first 5 minutes, I've run out of time for the last 5 questions, I'm going to guess? Or do you actually work out that the first 2 questions are the hardest and then the rest of the 8 questions really simple that you've done it, and now you've finished the exam, and now you've got 5-6 minutes of doing nothing. Now, what do you do? And that is a really tricky question. It depends on what's been asked of you, what's been done. But from my personal experience, for single way or one way questions, for these particular type of questions, you want to allocate the right time. And that is probably the best way to do it. You do the question, you've got 10 questions, you've got 10 minutes. You spend 1 minute per question. At the end of the 1 minute, then you move on. You've got to be very rigorous in this. You can play the game, you can overthink things, but at the minute, 10 minutes, 10 questions, 1 minute per 1 mark. Okay, do the question. At the end of the 1 minute, if you think, do you know what, it's not coming back to me, I don't know the answer, then guess the answer that you think is right. Always put an answer down if it's one way, and then move on. Even if you have 2-3 minutes spare at the end of the test and you cannot review the previous questions, that is fine, because you have spent the right amount of time, 1 minute per question, for all the one-way questions. The last thing you want to do is spend 3-4 minutes on one question, and then you realize you've got 7 minutes for 9 questions, and the time that you have left is much more constrained. So this is a similar method for all sorts of questions. Sometimes examiners love to put really difficult questions at the beginning to mentally disrupt the flow of students so that they spend a lot of time on these sort of questions. Don't let that phase you. Do the question. If you can't do the questions, guess, especially if it's a one-way system, and then move on, and then spend the accurate amount of time in dealing with all the rest of the questions. This is a very unique exam, and hopefully this technique will help you. How do you manage tricky questions? That's a good question. So what's tricky for one person may not be tricky for another person. So the technique I normally use for, say, MCQ-based questions, if I get a tricky question, I will normally leave it. Okay, I normally say, right, this is a question asking me about this particular scenario. I've got no idea what this is. I have no idea. It may be option C, but I just be guessing. I've got, 20% confidence. So 1 in 5 is a guess. Or I might say, do you know what? It's a tricky question, but I think it's 50-50 between A and C, but I'll put C down anyway. Either way, I want to put a confidence marker on the side. That's 1, 2, 3, 4, 5. 5 is the most confident, and 1 is not confident at all. So for example, if I say, oh, this is really tricky, and I'm going to put a confidence interval of 1, I'll give it a 1 minute, put down 1, and then move on to the next question and do all the questions that I can do. Don't let that tricky question waste my time or affect mentally all the other questions sequentially. And this is the same if you're doing OSCE scenarios, right? If you are doing OSCE scenarios where you're doing patient contact and you move from one station to the next, and this might be the same for your final exam, this might be the same for your postgraduate exam, but this again goes to the one-way MCQ system. You only have one shot to impress the examiner. You can't go back and rush into the last station and say, sorry, I didn't demonstrate this technique. Let me show you how I also take the heart. It's a one-way system. So do not let one poor station disrupt your method. Okay, plan the exam by question numbers, by question time, and then move on appropriately. And if you have time and it's not a one-way question system, go back and focus on the easier questions, the medium questions, confidence interval 3, 4, and then the last iteration, focus on 1 and 2, because those are the questions that other people will usually find tricky as well. But what you want to do is guarantee the questions, confidence interval 3, 4, 5, those ones that you guarantee and get the maximum marks possible. Okay, so a person asks, how do you reduce stress on the day before the exam? Stress is self-imposed, okay? What's causing you stress? Stress can be internal, can be external. Is intrinsic or extrinsic? And that's what you need to know. If there's extrinsic stress in the sense that, oh my goodness, I'm late for the exam is happening in 2 minutes time, I am 3 miles away from the exam hall, that is extrinsic stress because of the stress of something else that's been put in. Intrinsic stress is to say, do you know what, I need to get 100% in the exam, because if I don't get it, I'll be kicked out of medical school, my parents will laugh at me, my tutors, my teachers will laugh at me. That's intrinsic stress because you're putting that pressure on yourself. Extrinsic stress you can deal with because you'll say to yourself, right, I will get to the exam hall 30 minutes before the exam, ready, I won't go to the toilet, I'll get everything ready, phone switched off, and I'll be ready. Okay, that's preparation. You can deal with extrinsic stress. Intrinsic stress, the stress that you put upon yourself to perform, is going to be very, very tricky. But you need to do that. And to do so, go back to my second webinars where I said about finding your flow. Even when you are an Olympian and you're running for a gold medal in the 100-meter sprint, the Olympians, the sprinters, they are going to be stressed. They have the weight of their trainers. 4 years of training has led up to this day. The whole weight of the country's hopes and aspirations are placed upon them. If they are stressed, it will impact on their performance. So they need to find their flow. They need to be able to block out stress. They need to be able to take the right appropriate steps to go forward so that they can dominate the field. And this is what you need to do. You need to find how to expel stress. And I discussed this with you on the 4-7-8 technique and other ways in terms of extrinsic stress, which we discussed about planning. So take a look at the webinar 2 and then this webinar as well to get more insight. Okay, so how could we possibly deal with an exam fail despite hard studying? Let me give you something to think about, okay? So you may see me giving you exam techniques, study skills, etc., all sorts of stuff. But let me tell you now. So I've written, many books, textbooks that you might hopefully have read. I'm editorial head of different exams, giving talks on exams, etc. But let me tell you one thing. When I was doing my medical school exams, there was one year I did quite bad in the mocks. And my tutor came up to me and said, Phil, you're actually in the bottom 10 of the year. You're failing your tests. And this wasn't bottom 10%. This wasn't a bottom 10% decile. This was bottom 10 of Cambridge. But look at me now. How you deal with failure, how you pick yourself up, that is what's going to differentiate yourself and someone else. This is why you are here in medical school, okay? And that is an important thing. If everyone will have failures, right? People may have failed driving tests, people may have failed in relationships, in lives, and in whatever. There's going to be failures. Failure is part of life. How you pick yourself up from a failure, how you remotivate yourself, how you reflect on that, how you react on that, and going forward, that is the key point for you. And let me be the face-to-face example of someone that the tutor has said, you're in danger of failing your medical school exams to getting a triple third at Cambridge. You can do this. It's a mindset thing. What if I find it difficult to write down my own notes? There are different tools, different apps that you can find, but I will be honest, writing down your own notes is so crucial, so important, because if you were to type it on a computer, if you were to read someone else's notes, you don't process it as much. Now, don't get me wrong, you could have done it differently and it could well be different for you, and you may well be able to suit that sort of question and that sort of revision schedule better. But in my experience, active learning, writing your own notes is going to be the key. If you can't, that's fine. Sometimes I don't write down any notes. I just take a blank sheet of paper. I draw spider diagrams in terms of the main subject headings and verbally and quietly just say to myself, what are the main points? And that's often a lot quicker than putting pen to paper. But active learning, active recall is the main thing in all of this. It doesn't have to be notes. It could be active recall. There's no point writing hundreds of pages of notes, but you don't remember it all, or just copying it straight from a textbook. You need to actually process it to get active learning here. We'll do one more question. Okay. Do you have any tips for passing an oral exam, which is a viva? Okay. So vivas can appear either for your dissertation, postgraduate, or during your graduate degree, or it could happen at the end of an OSCE. So for example, you examine the patient and the examiner says, right, tell me about the 10 different causes of irregular heartbeat, or tell me the management of aortic stenosis. Now, the way to position this is be confident in your answers. You either know the answers or you don't know the answers, okay? And be confident. If you don't know the answers, it's going to be very difficult for you to say anything, but you should try and say something. So for myself, I will always be respectful. So I take my stethoscope down. If this was a clinical OSCE viva, or if this is just a normal viva with an examiner next to me, I just say, sir, thank you very much for your question. As I understand your question, you're asking me about the causes of irregular heart rhythm. Is that correct? It can be classified as bam, 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 bam. Always try and classify if you can, and speak slowly, meticulously, because that will buy you time. That shows confidence as well. I'll give you one quick anecdote. I still remember this. It was during my MRCP test, I think it was, where we had a neurology station and the patient had myotonic dystrophy. Okay, I know that now. I didn't know it then. And at the end of the exam, this professor with a bow tie asked me, so, Dr. Xiu, can you tell me what is the genetic mode for this patient, or for this pathology, for this particular patient? Okay. Then I was like, oh my goodness, I've got no idea. I examined the patient. I had no idea what the diagnosis was. So I just said, thank you very much for the question, sir. I believe in terms of the genetic pathology for this patient, there is going to be variable penetration. And I used that because I knew that pretty much all diseases had variable penetration, but then the professor knew as well. So he just said, Phil, look, that goes for pretty much all diseases, does it not? And I just smiled and said, yes, yes, indeed. And then the bell rang, and then it was time to move on. But you can clearly see, you've got to be confident in yourself. What you say that is incorrect will be marked down for you. If you say something silly and that's incorrect, then that would not be good. If you don't say it, at least the examiner has the perception. You may be aware of it. You may know the answer, but you don't have the time. So it's unassumed that maybe the global scale, the mark will be a bit higher rather than the checklist scale where you actually mark is a little bit lower because you don't know the actual factual thing. So for that station, I don't think I passed it as such, but he passed me overall. So bear that in mind when you do answer. These are all exam techniques, obviously, but the easiest way to know it is if you actually know the answer to the question that they're asking you. It's been a pleasure to interact with all of you, but I can see one final question I just want to quickly answer, okay? There's a number of you that's asked about anatomy, how to revise anatomy. And, if you go back to my first webinar, I shared with you an experience. I had a friend who was very intelligent. When he closed his eyes, he could read Grey's Anatomy in his dreams. It's scary. He would say, page 174, top right page, there's this paragraph, word for word. He'd be able to recall. Amazing. I don't have that memory, and we still did quite well. Questions now are coming through. How do you revise anatomy? Well, there's two things you could do. So you really do need an anatomy atlas. And in this day and age, I'd advise you either getting atlases that we have here from Elsevier, or you can get complete anatomy that you can get as an online subscription or online price, as well as some sort of anatomy textbook like Grey's Anatomy that Elsevier publishes, or Crash Course Anatomy. Anatomy is tricky. Anatomy is difficult, but what you want to do is correlate that with clinical significance. Why am I learning about the thorax? Why am I learning about the abdomen? Well, if you use something like clinically oriented anatomy, also published by Elsevier, then you can correlate that in terms of why it is important, because you will need to know that anatomy knowledge in the future. And always bear that in mind. It's not just raw list of old Latin text. It's about how else you can use it in terms of pathology now and also in the future.